Now into a fourth year, the COVID-19 pandemic has had a profound impact on health workers on the front lines. In particular, it has impacted women, who have led the response to the pandemic in the health sector, holding 70% of health worker jobs and over 80% of nursing and midwifery roles. Women health workers, from doctors to community health workers, have worked tirelessly, risking their lives. They've suffered wearing inadequate personal protective equipment designed for male bodies, leaving them vulnerable and feeling undervalued. On top of the increased patient load, women health workers have shouldered additional hours of unpaid care work, often managing their families, elderly relatives, and households. With women earning 24% less than men in the sector, and many working unpaid or for low stipends, the pandemic's economic shocks have hit women the hardest. Here's where the story takes a turn. Women are saying enough is enough and voting with their feet. A global trend in the health sector is emerging: the Great Resignation, with evidence suggesting that many women health workers, especially in high-income countries, are leaving or planning to leave the profession. This trend unfolds against the backdrop of an already alarming global health worker shortage. According to the World Health Organization, there was a deficit of 15 million health workers even before the pandemic started. Lives have been lost, and many women health workers face long COVID. Mass resignations have struck the sector, with nearly 1 in 5 health workers leaving in the USA alone. Across the Atlantic, the UK saw over 27,000 staff volunteers resign from the National Health Services in the summer of 2021. Men and women are leaving the profession, but we focus on women health workers because they are the majority. And the measures urgently needed to retain and recruit them will largely be determined by gender. We urgently need coordinated government action to address health worker attrition in the short term and formulate long-term, sustainable solutions without resorting to unethical international recruitment. The pandemic has cast a glaring spotlight on the role of women health workers and the inequalities they face. To retain and attract these women back, we must usher in gender transformative change, ensuring equal leadership, safe and decent work, and fair pay. Women in the health workforce deserve a new social contract, one based on equity. This contract will enable them to deliver health for all. Join us in taking action to address the Great Resignation and support the woman at the heart of global health.